And a van driver involved in a head-on collision needs urgent skin grafts to save his legs.
This unfortunate man sustained full-thickness burns, and if you leave them, it gets infected with significant scarring that will result in deformity and limited range of movement.
Last time on Medical Emergency, van driver Tony was brought to the Alfred suffering from burns to his lower legs.
Fractured skull, fractured ribs.
Tony was involved in a head-on collision. His van burst into flames and passing motorists used tow ropes to pull the cars apart. The quick-thinking heroism undoubtedly saved Tony's life, but his legs were badly burnt.
This unfortunate man sustained full-thickness burns. Full thickness means that his burns are full-thickness layers of the skin, and that could be down to just fat, or it could be including fat, muscles, and even bone. With full-thickness burns, they never heal on their own, and if you leave them, it gets infected with significant scarring that will result in deformity and limited range of movement of the ankle. So we have to cut out all the dead skin and put a skin graft on. With using the scratchy pads, I scrub the burn and see if it bleeds at all. You can see here, right at the edge, it starts to bleed because that's partial thickness. But if you scratch this one, you can scratch for the whole day and you wouldn't get any bleeding because it's a full thickness burn. Okay, tourniquet up to 3 feet.
Tony will need a skin graft.
Okay, can I have the breast weight knife, please? And
The first task is to remove the dead skin from the burnt area.
And we start cutting the burnt tissue down to a bleeding, healthy tissue. After we finish, we'll put the tourniquet down and see what's bleeding and what's not bleeding.
Once Mr. Morsi is happy that there is only healthy tissue left, skin will be taken from Tony's thigh and grafted onto the damaged areas. Without an operation like this, Tony could lose all movement in his lower legs. Van driver Tony is having a skin graft on the burnt areas of his lower legs. Healthy skin will be taken from Tony's thigh.
When we take the skin graft, we make holes in the graft through meshing it so the blood can find its way out. Because if the blood collected under the skin graft, it will lift the skin graft off and you lose the skin graft. So you can see the mesh pattern. If I stretch the skin, I open up the holes. And if I don't stretch the skin, I close the hole. So I can control the size of the holes. Depends on whether I have enough skin or not.
New blood vessels should begin to grow from the recipient area into the transplanted skin within 36 hours. By that stage, doctors should know if the graft has taken. 2 days after his surgery and skin grafts, van driver Tony is having his burns dressed.
It looks worse than it feels.
So take the old dressing off and then we'll give you a bit of a clean up and pop a new one on for you. All right, you let us know if you feel uncomfortable at any point.
Okay.
The skin grafts have a good blood supply and have taken well.
There? Is it the staples that are hurting?
Yeah.
All right, you just let me know if you need a break. You doing all right there?
Yeah.
Yep. Okay, we're done.
Oh, the pain ultimately comes from more where they took the skin off than where the actual repair has been done. But it's life.
That looks really, really good. That's healing really well.
Painful though it is, Tony's a very lucky man.
Is that I believe 3 people got involved pulling me out of the car. With the car in flames, they're really our heroes, really. Keep thinking how lucky I am to be talking today.
Tony was kept in hospital for 8 weeks. It will take several months before he regains full mobility of his legs. The 3 men who saved Tony and the other driver John have been commended for their bravery. Ice hockey player Vlad was released from hospital the next day.
Go the Mighty Bears.
He returned to the ice the following week and beat the same team 3-0. Felicity had a broken bone in her foot and was in plaster for 6 weeks. Unfortunately, she missed out on the bargain she'd been shopping for. And Richard awakens to the day of his surgery.
So there you can see the aortic aneurysm just here.
How surgeons fix his dangerously swollen aorta, next time on Medical Emergency.